And it's even the correct one. So how cool is that? Now, we looked at the bony landmarks. So there's the acromioclavicular joint. The first piece of tape should have been that one. Anybody seen my other demo on the shoulder? This one I suggest being your first one that goes across like that. Then the next ones can be either or, but usually my order is the one that goes across here, then the one that goes down for deltoid, and then the two that'll come across from the front and posterior sides. All right, we'll start with green, because why not? Pre-tear and anchor. And then with this one, I'm going to take off the whole middle section of the tape. Now, if I have a nuance with this, at least specific to the shoulder, it tends to be, I'm gonna have her orient where it feels like it's like supposed to be locked in the best posture you could think of. So it's usually depressed like that. You see how it kind of went into retraction and then depression, the good side of depression. And you just hold it, lock it in right there. What I want to then do is put the tape right over that joint line. I search right there, and then go right over top of it. This is one where I do a lot of tension. I'm gonna go, just let that hang out like that. Come here. This anchor I'm gonna let be a bigger one. So let me confirm. Yep, we did good. This anchor down. So it doesn't have to be perfectly symmetrical. I want to make sure that there's a lot of tension just right over top of that joint blade. Okay? That one, good. Confirm. No seams. Doing good. And we can visualize it even better. The next one goes with some hot pink. Now here, relative to firing patterns, like the rotator cuff muscles all have small jobs of movement. They're mostly about stability, but looking about how these are oriented. Supraspinatus, superior to the spine, it's a little shoulder abductor. Mostly it's holding the humerus up, not letting it drop down, okay? Then infraspinatus is bracketing it on the posterior side, but it can do a little external rotation. Teres minor and major are more about traditional adduction, maybe a little extension, but think about them as kind of counterbalancing supraspinatus. So teres minor, and I think about teres major as well as part of this. They're counterbalancing that. And then subscapularis is counterbalancing infraspinatus. So infraspinatus and subscapularis are antagonists to each other. They wrap all the way around the shoulder joint like this, and it's not uncommon for people to have just tight capsular joint issues with a kind of point like this. It's deep here or deep here, and it probably has to do with something related to these tendons where they're attaching and hugging around. You can see how supraspinatus comes down over there, and the knees come down and around. So that can be the added benefit of just making sure that whole shoulder joint line is covered, is that maybe sensation-wise we're distracting the rotator cuff muscles. And maybe by giving them the perception of extra stability, they will chill out and reduce in tone a little bit. But it might not be that we create any actual stability. We're just tricking those muscles to think that the tape is doing that, so they can just give the impression, oh, somebody else showed up to the game, I can calm down. All right, so here, anchor. The neck is already on tension because we took the pillow out. There we go. Make sure. Good. And here I'm going to trace down, find where the deltoid attachment is. What's cool is this hexagon is right over the AC joint, so I can be like, I want to be right over top of that. Holding this, and I can do a couple things while I'm doing this. As I do this, I can be holding the skin even in more tension. Coming down. Then ironing. Really good. Important thing again, don't skimp on bringing this tape down over deltoid. You're better off having it short here on upper trap, even if the anchor had to be just here, compared to not having enough down here. All right, then some more green. Then we're going to do one for the anterior chest. And on some level, I can at least be sending a prayer or a message to subscapularis relative to that internal rotation. Most people get stuck elevated and protracted and internally rotated. So I want to try to counterbalance that with this. So I'm going to have you kind of roll your shoulder back just a little bit. That's good. Arms straight. Now this one, I have to make sure my anchor is not on that tape, but this was for the other demonstration where I had made a misstep, where I put that AC joint one on later, and then it wasn't able to attach anywhere but on tape, where I had to go really low onto the chest. So this way, this piece of tape is actually holding that anchor down. And if anything, it's actually reinforcing it. The other order of stuff, as said, doesn't really matter. It's just do that one first. Okay, now I gotta make sure I come across that joint line. Good. And go ahead and go back. And then 0% tension. I'll try not to cover the sunflower. I got it a little bit. But it's aimed up, it's gonna look like it just has petals sprouting. Okay. And that'll be the only thing you gotta watch out for is the seam there. Sometimes that wants to, it's not always a big deal if it doesn't stick down, but ideally I get it to where along that line it stays down. Now once I get done, get near done, if I can have Sarah grab me some of the dry hot towels. Not quite yet. All right, so now this one, I'm gonna come just straighten the elbow out because I'm gonna be a little bit more on the anterior upper arm. So I just want that a bit on tension. Go ahead and relax. There's no tension on this anchor, so it doesn't have to be anything too crazy. But now, where coracobrachialis attaches, that's where the coracoid process is. So we have two pieces of tape overlapping. So ideally that's affecting that. If I needed to be more precise with it, then we could do a piece of tape that just ran right along with that, but I feel like this is gonna do the job. For the most part, I think somebody had stated, like, is this just a good format for almost all shoulder things? And the answer is yes. In many cases, just doing this application will get you into a helpful territory for almost all shoulder issues. Now here's where I have to try to watch out because of that anchor. So I'm going to be able to come down and around, and I'm going to be sending a message to teres major and minor. One turned out okay. And then we'll be ready for hot towels. What's nice about most like clinic spaces, like you'd have that hot towel cabbie like right by you. So you'd be able to grab that and apply that. Wonderful, thank you. That's a nice thing for you, you already have the hot towel cabbie. Other things I've seen people use is hair dryers. It's just not the most, imagine that in your ear. So you certainly could use something like that to just use the hot air. I'm gonna make sure that's good. here. And I mean, voila, that's all there is to it.